Good day. Thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabert Schuster, State Director for AARP in this territory. As the largest nonprofit, nonpartisan organization in the United States, AARP has been championing efforts to empower Americans 50 and older to choose how they live as they age. With nearly 38 million members nationwide and 22,000 here in this territory, AARP works to strengthen communities and advocate for what matters most to families, with a focus on health security, financial stability, and personal fulfillment. AARP has invited the director of the Virgin Islands State Health Insurance Program, also known as VI-SHIP, Shani Amory, to join us on today's episode for a discussion on patient-centered approaches to healthcare delivery and how the recent changes to the Medicare program can yield influence on the health system in the Virgin Islands. So, Shani, welcome.
Hi, good day. Thank you for having us, Troy.
Thank you. Thank you for making the time to be with us. I'm sure you're very busy running the VI ship office for the entire territory. I know you're in St. Thomas, but you also run the office here on St. Croix, right?
Yes, I do. Yes, I do. So we have two offices in the territory, one here in St. Thomas for St. Thomas and for St. John, and we have the St. Croix office as well.
Great. And so tell us, what does the VI ship office do? It seems to be a mystery in the minds of many people. Even when I first came to AARP and started hearing about it, it took me a while to learn all of what VI ship does. So if you'll give us a brief overview of what your office does.
Okay, so when people hear VI ship, they, for some strange reason, think that we're a shipping company or that we deal, with allowing vehicles to be shipped from the U.S. mainland here to the territory. So VI ship, we are not a shipping, entity. Like you said before, VI ship is an acronym for the Virgin Islands State Health Insurance Program, and we are the local Medicare source for Medicare beneficiaries who reside here in the Virgin Islands.
Great. And so VI ship is part of the Office of the Lieutenant Governor?
Yes, that is correct. So we're a division with Lieutenant Governor's Office, but we are federally administered by the Center for Medicare and Medicaid Services. And that's where we get our funding from, to perform our outreach, to educate our community. That's where we get our funding from. But we are locally administered by Lieutenant Governor's Office.
Okay, so specifically then, VI ship deals with matters of Medicare and Medicaid.
So let's differentiate right there. Okay. So we do have beneficiaries who are dually eligible. So they are with Medicare and also Medicaid. Okay. But we only assist with the portion that deals with Medicare specifically. So I guess we can differentiate right now between Medicare and Medicaid.
Mhm.
Medicare is for individuals who are 65 years or older or who have been collecting disability for 24 calendar months. They're eligible for Medicare, and that is a health insurance program from the federal government. In contrast, Medicaid is for individuals of any age who are able to be eligible because of their financial situations. So, that can
Okay,
be children, that can also be 65 years as older as well. So we do have many beneficiaries who we serve who are both in Medicare and also in Medicaid. But Medicaid actually falls under the Department of Human Services, whereas Medicare falls under Lieutenant Governor's Office.
so anybody who has any questions about Medicaid needs to go to the Medicaid program or MAP in the Department of Human
Human
Services.
Services. Yes. But like I said, we do have those who are dual eligibles who are both in Medicare and also Medicaid, and we are here to assist those who understand how the programs work together.
So a little bit about how they work together, because I find this to be quite interesting. If an individual qualifies for both Medicare and Medicaid, Which should be
Mm-hmm.
their primary and which should be their secondary, or do they stand side by side?
Okay, so for dual eligibles, the Medicare will pay first when you're dual eligible, and Medicaid will then cover whatever, typically whatever else isn't covered by Medicare, Medicaid will then pick up.
Okay.
Okay. So, and those beneficiaries, they have like they're able to get like a full scope, of health services, because like I said before, whatever Medicare isn't covering, Medicaid is going to pick up. In addition to that, Medicaid also is beneficial for them because if they are able, to display a further financial strain, like with their Part B for
Mhm.
Medicare, the Part B will be, for doctor visits, durable equipment. Medicaid has a buy-in program where they can assist with covering that, in regards to their Medicare Part B coverage. Um, another um, Another benefit for those dual eligible beneficiaries is that they also are able to get extra pharmaceutical assistance, once they're deemed to be eligible for both Medicare and also for Medicaid. So Medicaid can offer assistance with their Part D coverage, and that's for the drug prescription part under Medicare. In addition to that, there's also the pharmaceutical assistance program that they can benefit from as well. But in order, to qualify for those, I want to share, in order to qualify, for the buy and also for the pharmaceutical and for the Part D coverage, that is also done through Medicaid under Human Services. So, if we meet a beneficiary who's dual eligible, and we say, okay, well, you want some Part D, prescription coverage, or they express, having an issue covering my Part B, we can connect them with Human Services, Medicaid, with their case manager to see how Medicaid can provide that extra assistance for them.
Now, looking at all the different parts of Medicare, I'm always confused by all of that, the Part B, Part D, Part this and that. Can you give us just a very high level overview of the different parts of Medicare and what each part covers? Just high level. I'm sure there's a lot of detail under each part, but if you can just give us a high
Yes.
level view.
We can go on and on about Medicare. So, with Medicare, there are different parts. You have the Part A, you have the Part B, and then you also have the Part C, and then there's also the Part D as well too. So, with the Part A coverage, that will include hospital visits. You have to go to the hospital. Part A will cover um, those services for the beneficiary. And this is just, an overview. For those beneficiaries who also have the Part B, that will cover doctor visits, that will cover any procedures that have to be done, that will cover lab work. You also have the Part C, which is Medicare Advantage plan. They also have the Part D, which is the drug prescription plans. And with those plans, Medicare through a private insurance company, they are assisting the beneficiary with their drug prescription coverage. So, with the different parts, it's important to understand that the services have to be deemed to be medically necessary by Medicare. Medically, that is the term that Medicare uses often, medically necessary. Okay. And so, once the service is medically necessary, and also once a provider accepts Medicare will then, cover the services that fall under the Part A or the Part B.
Okay. Now, I'm going to ask some questions specifically about Advantage and RX, but before we get into that, just a disclaimer for our listening and viewing audience that AARP is not an insurance company. AARP does not sell insurance. Many are familiar with the AARP branded Medicare supplemental insurance, but that is not provided by AARP. That's provided by United Healthcare. Again, AARP is not an insurance company. We are not advertising any insurance product. As the state director of AARP and my other employees here in the Virgin Islands, we cannot answer any questions about any insurance product. If anybody has a question about Medicare supplemental insurance, you will be referred by us to the VI SHIP office under the direction of Shani. So again, AARP is not an insurance company. So this advantage that you mentioned, Medicare Advantage in the Part C, is that AARP, is that supplemental insurance, or is that Medicare proper? What is the Advantage program?
So the Medicare Advantage plan, that's also known as Part C, this is a plan where there are other additions that are provided, such as, vision or dental. Okay. So original Medicare does
Okay.
not provide, vision or dental, but we can easily just look at the Medicare Advantage plan as providing broader services to Medicare beneficiaries. I think that's the
Okay.
easiest way, to look at the Medicare part, the Medicare Part C, the Medicare Advantage plans.
And so that Medicare Advantage is provided by Medicare itself, or is that a private provider?
It will be a private provider as well. So
Okay.
it will be a private provider as well. So some beneficiaries may feel as if here in the VI, Medicare isn't offering an Advantage plan, but Medicare itself does not offer the Advantage plans. It will be private insurance companies who are creating, their own, setting up their own policies and selling those plans to Medicare beneficiaries as an Advantage plan.
Okay, and similarly, the Part D is also through a private provider?
Is also offered from private insurance companies as well, who are approved by Medicare to sell the Part D plans.
Okay, and so if somebody wants to have the Medicare Part C and Part D, will they also be able to enroll in those programs through the VI SHIP office?
Okay, so in reference to the Advantage plan, their VI SHIP is unable to assist because there currently are no Advantage plans available to all beneficiaries here in the Virgin Islands. Okay, but in reference to Part D, we can assist beneficiaries in enrolling into Part D plans and also into supplement plans. And the way the supplement plans work, those are plans that that assist Medicare beneficiaries with their co-payments, with their deductibles, stuff like that. However, the supplement plans only supplements the original Medicare. It does not add on additional services such as, the vision, the dental. It only supplements the original Medicare, which is Part A and Part B, by assisting the beneficiary with covering their deductibles, covering their co-payments, stuff of that nature.
I see. And so is there a particular part, I don't know, is there a Part F or a Part J, let's say, that refers to the supplemental plans?
Yes.
Or is it just supplemental?
So under the supplement plan, so we can assist Medicare beneficiaries in understanding what, if they call and if they come and say that they want to sign up for a Medicare supplement plan, we can assist them in looking at what their Medicare options are. And that's very important with what VI SHIP does. We not only educate, but we also help them to understand what options are available for them through their Medicare coverage. So through the supplement plans, there are different plans that are available. Supplement plans, you have the Plan G and the Plan F, which is what most beneficiaries want to sign up for. There are, other plans that may be not as costly, but with that, they don't have as much benefits as the other plans have that are available, the other supplement plans have.
So the G and the F, would somebody sign up for both Part G and Part F, or just one of those?
Yes, so only one supplement plan will be needed for a beneficiary to sign up for. Only one plan will be needed. Okay,
And
I'm sorry.
go ahead.
Go ahead.
No,
No,
no, you.
I was just gonna state, for beneficiaries who are already enrolled in the Part D or even a supplement plan, some people may call and say, "Hey, I know, like I need to renew. I don't want to lose my coverage." I want them to understand that the coverage doesn't cancel out; it carries over from year to year. Now, right about now, they should be receiving, notifications in the mail about, what changes there may be. Okay. So, so look out for those notices. And any questions, they can give us a call so that we can help to understand what changes may be in place for 2023 in regards to their supplement and their Part D plans.
And what types of supplemental insurance are offered here in the Virgin Islands? Medicare supplemental.
What types?
Yes.
Okay, so like I said, so there plans that are available. So from one plan to another, what may change would be the cost. So example, for those that cost more, you may see where one plan will cover the Part B deductible, meaning that when the beneficiary goes to the doctor, they can immediately, present their original Medicare card and also present their supplement card, and they wouldn't have to pay a copay. So everything will be covered immediately. Okay. And then another plan, that may be a bit cheaper than that. It may offer the same services that the plan F will offer. However, they will have to meet their Part B deductible. And once they meet that deductible, that would be when the supplement plan kicks in. And these additional services, they can cover like hospital stays, additional hospital stays, long care, long care, long care facility, so we will see the supplement plans, offering a supplement so what original Medicare may offer for those services. So, so like I said, from one plan to another, we will see different services that are provided, and it just all depends on the cost. So, the, the more that is provided, of course, that plan will be at a higher cost for the beneficiary. That'll be a higher monthly premium payment for the beneficiary. But
Okay.
they're
Now,
great. I'm sorry. Go ahead.
yeah, so before my next question, again, a
Mm-hmm.
disclaimer that we're not advertising or recommending any, at least from AARP's perspective, we're not recommending any particular Medicare supplemental. But I feel like I need to ask the question because many people ask the question, and we get this question all the time at AARP. Um, so that is, some years ago, from our understanding, the only Medicare supplemental insurance was the one provided by United Healthcare that carried the AARP brand, again, provided by United Healthcare. Now it's come to our understanding that there are different kinds of supplementals. So you have a supplemental that's offered to government retirees, and as well as the AARP's Medicare supplemental still existing. Can you compare and contrast that for us and
Okay.
help our listening audience to come to a better understanding of those two basic types of supplemental insurance?
Okay. So what is actually being offered to government retirees once they are 65 and they're on Medicare and they have both Medicare Part A and Part B, they have been merged onto a Medicare Advantage plan. And this Advantage plan was created, by the Department of Personnel specifically for their retirees. So that means that unless the beneficiary is retired from the VI government, they are not eligible for that Medicare Advantage plan. That plan is also offered through United Healthcare as well. Okay. But like I said before, we get the phone calls as well, but unfortunately, we don't have a policy here in the VI that will accept all Medicare beneficiaries into their Advantage plan. The one that is here right now is specifically only for the retirees who are 65 years and older and who want Medicare. They have both Medicare Part A and Part B. Okay, so what is available to beneficiaries who are not retirees from the VA government, though, like we said before, is the supplement plans. So, it all falls under, like you said before, United Healthcare, but the supplement plans are available to everyone, whereas the Advance is only going to be available to government retirees from the VI government. And I'm hoping that brings some kind of clarification because, like I said, we get the phone calls all the time, and it's great, what personnel did. It's an awesome plan. I went to their open enrollment meetings that were held in August, and it's a great plan that they have for their retirees. And, you know, um, we cannot force, an insurance carrier provider to say, offer your service to all Medicare beneficiaries. We cannot enforce that, but we can just, keep our fingers crossed that sometime, someday soon, it will be open to everyone.
You referred to that supplemental plan for government retirees as Advantage. Is that the
Yeah.
same as Part C, or that's different from Part C Advantage?
So what the retirees have is not a supplement plan, it's different. So it's called an Advantage plan, which is Medicare Part C. Okay.
Okay.
So the supplement plans, those are also known as Medigap policies, and that's what's available for all. So there's a distinction between Medicare Advantage plans and the Medicare supplement plans. They aren't the same.
I so appreciate your explanation, but it seems like the more I learn, the more confused I become because there's so many twists and turns to this whole issue of Medicare. So so
Um,
if
no,
no, you're
I was
doing.
saying that my screen was buffering for about 5 seconds. I'm so sorry. So if you were asking another question, I missed that question. I'm sorry.
Yeah, no, just to recap, I was saying that the more I learn about Medicare and all these different parts, I feel like I'm becoming a little bit more confused.
And I'm just
There's some clarity, but it's so many twists and turns, and you're doing a fine job explaining, but it's just
it's
that it's so much to
so
understand.
it's so much. I say you can look at Medicare as being like an intricate web, or a maze. You know what I mean? And it can be very confusing. And that is why at VI Ship, our goal is to empower, to educate, to assess our beneficiaries so they can fully understand how their Medicare insurance works. Because like you said, it is very confusing. There are so many parts, but however, despite the confusion that may occur, VI Ship is here to help. And we're doing this assistance through one-on-one counseling. We are finally going to be out in the community again, being able to do outreach events. I came on in
Great.
2020, and that was during the height of the pandemic. And at the time,
Yeah.
we completely weren't doing anything. Well, I don't want to say we weren't doing anything. We were serving our beneficiary, but it was over the telephone or via email. To keep that most vulnerable population safe, we had to cease with in-person sessions and also with the outreach as well too. But we still were here. We did we had several radio interviews that we did. We had several ads that were running. But our culture, we like to be face to face. We like to sit down.
Yes.
And when they come in, they want to bring in, their paper so they can say, Miss Penny, or my to break down and explain, what they receive from Medicare. So we are anxious to be back in person, because I think that in person contact goes a long way, and it may bring more clarification also as well.
Fantastic. And going back again to the Medicare Advantage plan offered to government retirees,
Yes.
does that Medicare Advantage plan work like a supplemental plan? Because you mentioned that the supplemental plans are still there. So would a government
Mhm.
retiree need to enroll in that Medicare Advantage as well as have a supplemental plan? How does that work together?
So most people who are on the Medicare Advantage plan, for this Medicare Advantage plan here in the Virgin Islands, I'm understanding that there really is no need for them to add on a supplement plan, because it's covering everything for them basically. Okay.
Okay.
So that is what I am understanding. And like I said, when I attended their enrollment seminars, about 2 months ago, they have they have everything checked off pretty much. So for those beneficiaries, there really is no need for them, to pay an additional amount for a supplement plan.
So for a non-government employee, let's look at non-government retirees, non-government Medicare beneficiaries. It would be still beneficial for them to have the Part C, which covers the vision and the dental, and it
Well,
would all.
they're okay. I'm sorry. I didn't mean to interrupt you, but I do want to stress that there is no Medicare Advantage plan available to non-government beneficiaries here in the Virgin Islands.
None. Okay,
None.
so a non-government retiree can have Part A for hospital, can have Part B for doctors, labs, etc., can have Part D for prescription coverage, and then they would need to, if they so choose, to have a Medicare supplemental plan.
Yes, yes, that is correct.
Okay.
And like I said, we can help them. We know that many people have financial hardships, so we can help them to sit down and to say, okay, well, if you want a supplement plan, this may be the plan that is best for you. So like I said, we assess every beneficiary because every situation is different. We assess everyone individually to help them to determine which plan will be best for them, which coverage is best for them.
Okay, great, great. Well, I feel like I have a lot more clarity on all of this. So again, with those supplemental plans, that's where you're starting to hit Part G or Part F, depending on the
Yes.
supplemental plan that you get.
Yes, that the individual chooses to get. It is entirely that person's choice which one they decide to select.
Now, when somebody reaches the age of being a Medicare beneficiary, do they automatically get A and B, or do they just get one and they have to opt into another? How does that work
Okay.
initially?
So during when a person is about so be 3 months before a person makes 65 and up to 3 months after they make 65, this is the time for them, to look at their coverage, see what they need. Okay. Medicare is not mandatory. Okay. And neither are the parts mandatory. So a person can have the choice to have solely Part A or solely Part B. Or, they can go ahead and they can sign up for Medicare Part A and Part B. Some people, depending on what their situations may be, they may still be employed. So they may still be employed, and they may still be and they may still be receiving, creditable insurance coverage from their employer. So they may only want to get Part A or Part B. Okay. And then you have some instances where Medicare, the Part A is typically free, and some people can only afford the Part A, and they can't afford to pay the monthly premium for the for the Part B. So there are different situations where a beneficiary might decide to pick up only A, only B, or decide to go with A and B because that may be what they need.
Okay, and in the last 30 seconds, what is your web address and phone number?
Okay, so thanks for having us here again. So excited. You can view all upcoming events on our LGO Facebook page, obviously Lieutenant Governor's Facebook on page. We're going to be we're going to have some pop Saturday events. We have the event Saturday, the 22nd, and then also some dates in November as well. So we're going to be at Tutu Park Mall on the 22nd. We're going to be also in St. John and back in St. Croix in November. And there's going to be time for beneficiaries to actually come and sit with us and assess their plans and see that actually sign up for the Part D plan. So that was has had 30 seconds gone yet?
That's it. That's it. So thanks so much. I'm going to have you back on the show again because there's so many more
Yes,
questions. But Shani, thanks so much for being on the show
thank
with us today, and we
you.
look forward to having you in a future episode. Have a great
Definitely.
day.
Thank you. Have a great day as well, everyone.